Welcome to the health promotion part of newcomer orientation. Today, we will talk about being healthy in the United States. What do we mean when we use the word health? The World Health Organization defines health as a state of complete physical, mental, and social well-being and not merely the absence of disease and infirmity. When thinking about our health, we want to consider all aspects of ourselves and strive to take good care of our mind and soul, not just our bodies. Today, we will talk about how to live a healthy lifestyle in the United States. Specific topics that we will focus on include what to expect in the first few weeks of arrival to Buffalo, where to go for health services, the standard norms of health services in the U.S., healthy habits, hygiene, and the ongoing COVID-19 pandemic. First, we will talk about what to expect in your first few weeks of arrival to Buffalo. We hope you understand that only critical and immediate healthcare needs may be met in the initial weeks of resettlement. Medical emergencies can be dealt with on arrival. Pregnant women and individuals who need continuous treatment, such as someone with advanced kidney disease in need of regular dialysis, will be connected to healthcare services as soon as possible. You also need to complete a health assessment within the first 30 days of arrival. A Journey's End case manager will make you an appointment for the health assessment. The health assessment appointment will be at your primary care doctor's office. There are many good doctors in Buffalo. Your primary care office might be different from that of your friends. If you wish to change doctors, please talk to a case manager at Journey's End before trying to do it on your own. The health assessment includes a physical exam and immunizations. Certain immunizations, also referred to as shots, are required for children to attend school and are also required to apply for a green card. It is a very important appointment that you are required to attend. Here is a photo of the Refugee Health Assessment Form. Remember, it is your responsibility as a new arrival to attend this important health screening and any follow-up appointments. Next, we will talk about where you can go for health services. In many countries, when someone is sick, they just walk to the hospital and wait to be treated. Here in the United States, one must make an appointment to see the doctor, and the doctor has a separate office outside of the hospital. Call your doctor's office to make an appointment if you are experiencing mild or moderate symptoms that are not life-threatening. For example, you should call your doctor's office to make an appointment if you have a sore throat or a fever, or if you are struggling with other chronic issues such as insomnia or anxiety. It is also important to visit the doctor's office for routine checkups, which will allow your doctor to monitor any ongoing health issues in addition to screening for any illnesses that you are more susceptible to due to age or other factors. Your primary care doctor provides basic care, and it is important to visit yearly, even if you are healthy. Another important reason to visit your primary doctor's office regularly is so they can refer you to a specialty care doctor, also referred to as a specialist, if you have any health issues that need special attention. A specialty care doctor provides sophisticated and advanced medical care and treatment of a specific condition. Medical specialists dedicate their entire education and career to one specific topic and are highly skilled. For example, if you have a skin rash that will not go away, your primary doctor may refer you to a specialty care doctor who only treats skin conditions, called a dermatologist. This may feel like a whole new setup of responsibilities. Luckily, your doctor's office will communicate all of this to you and will schedule annual well visits and routine checkups as needed. Many new arrivals go to Jericho Road Community Health Center for primary care. Jericho Road has 3 different doctor's offices in the city of Buffalo. Jericho Road takes all private and government health insurances. Please don't let a lack of insurance prevent you from visiting Jericho Road. If you do not have insurance, Jericho Road has several options to help you. At Jericho Road, patients who do not qualify for Medicaid can receive a medical visit for as little as $20. based on your income and family size through a sliding fee discount program. You may also visit the Community Health Center of Buffalo, which has 4 locations in the Western New York area for primary care. Next, let's talk about when to go to the hospital. You should go to the hospital for an emergency. While you visit the doctor's office for routine care, you should visit the hospital for urgent care. For example, if you were involved in a serious car accident and sustained any injuries, you should go to the hospital. Sometimes, maybe you will be unsure if you should make a doctor's appointment or go to the hospital. For example, sharp, sudden pains in your abdomen could be food poisoning, or it could be something more serious like appendicitis. In this case, you can call your doctor's office to explain your symptoms, and they will advise you on what to do next. Your primary care doctor's office should have an after-hours answering service that will connect you with a medical provider from the office even if the office is closed. Other reasons you may visit the hospital include surgery or certain health screenings, also called tests. Surgery and tests will be scheduled ahead of time by your doctor as needed. Another reason you may go to the hospital is if you are pregnant and go into labor. Let's talk more about emergencies. What is a medical emergency? An emergency is an acute injury or illness that poses an immediate risk to a person's life or long-term health. In other words, an emergency is a severe injury or sudden illness that requires immediate medical care. In an emergency, if immediate medical care is not received, it may result in losing an arm, a leg, or your life. When you or a loved one is experiencing a serious medical emergency, call 911 right away. Calling 911 will connect you with a dispatcher who can send help. When you call 911 for a medical emergency, the dispatcher will send an ambulance. An ambulance is a medically equipped vehicle with life support systems and is used to transport sick and injured persons who require emergency medical care to the hospital and medical facilities. If you do not speak English well, you can simply say the language you speak and the dispatcher will add an interpreter to the call to provide language support. It is also very helpful to remember the phrase, "I need an interpreter," to use in this situation. Here are a few photos of nearby hospitals you may visit one day. On the left is a photo of Oshai Children's Hospital, which is where many pregnant women go to have their baby when the time comes. On the right is a photo of the Erie County Medical Center, also known as ECMC. ECMC is a Level 1 trauma center and specializes in providing medical care and treatment in emergencies. We are very lucky to live in Buffalo as there are several top-rated hospitals here, including these 2. Next, let's talk about mental health support. Emotional well-being is just as important as physical well-being. Just as humans experience injuries, trauma, and illness that affects our bodies and our physical health, we also experience injuries, trauma, and illness that affect our mind and mental health. Refugees, asylum seekers, SIVs, and parolees are at a higher risk of depression, anxiety, and post-traumatic stress disorder due to these life experiences. It is normal to have mental health struggles and periods of emotional turmoil. It is okay to seek help, and acknowledging that you struggle is the first step towards healing. There are many resources available to you here in Buffalo. In the United States, it is very common for people to visit a therapist on a regular basis. It is important to understand that the role of a therapist is to support you in your journey towards a better emotional well-being. A good therapist can guide you to develop effective and healthy coping skills and build a toolkit of strategies to maintain a better mindset. It is also common for people to take daily medication as a way to manage mental health struggles. Americans are very open about mental health, and we hope that you feel comfortable seeking the support you need. You can always talk to your primary doctor about any mental health struggles you are experiencing. Your doctor can introduce you to many different treatment options based on your needs and comfort level. You do not need a specific mental health diagnosis to seek help. As a refugee, asylee, SIV, or parolee who recently moved to the United States, you may be experiencing feelings of immense loss. The culture shock can also be very overwhelming. Treatment options may include talk therapy, behavioral therapy, medication, or a combination of these approaches. You can receive mental health services continuously for the rest of your life or temporarily as needed. One important thing to keep in mind is that you may go through a process of trial and error to find the right approach, so please do not get discouraged. There are many different therapeutic approaches, so you may have to try out a couple different therapists or medications to see which works best for you. Now, we will talk about standard norms of health services in the United States. First, let's talk about your responsibilities as a patient. In some cultures, when someone tells you to arrive at 1:30 p.m., it is okay to arrive at 2 or 2:30 p.m. In American culture, being late is considered disrespectful. You must arrive on time for each and every appointment. If you are late for your appointment, even just by 10 minutes, you will likely lose your appointment and have to reschedule for another day. However, sometimes you may be asked to sit in the waiting room before the doctor is ready to see you. That is okay. Even if the doctor's office or hospital is operating behind schedule, it is still your responsibility to always be on time as a patient. If for some reason you are unable to attend a scheduled appointment, call the doctor's office as soon as possible to notify them and to reschedule the appointment. You have a responsibility to the doctor, as well as to yourself, to talk openly about your lifestyle, habits, medical history, and to answer any questions the doctor has. It is in your best interest to disclose any hereditary or congenital diseases that are common in your family line so that your doctor can look for early signs of disease and take a proactive approach to detecting diseases for which you may be more at risk. Medical professionals have seen it all, so there's absolutely nothing to be ashamed or embarrassed about. As always, feel free to ask questions. Remember, your doctor is providing a service to you, so feel comfortable asking any questions you may have. Now, we will talk about your rights as a patient. As a patient, you have a right to language support. Any place that accepts Medicaid is required to provide an interpreter at no cost to you. Language support may be provided via language line or in person. Make sure to clearly communicate any specific preferences you may have. For example, if you prefer a female or male interpreter, or if you prefer language support from an interpreter over the phone or in person. While the office or hospital may not be able to accommodate your specific preferences every time, still feel free to make that request. Some medical offices do not have a lot of experience working with folks who don't speak English. Sometimes they will tell you to bring your own interpreter. Remember, this is not your responsibility. If a medical office tries to make you bring your own interpreter and you are uncomfortable with this, please talk to a case manager at Journey's End who can advocate on your behalf. Here are some helpful phrases to remember when requesting language support. For example, I speak, and then say the language that you speak. If you speak multiple dialects or languages, say each one. For example, Farsi and Dari. Sometimes it may be helpful to say which country you are from as well if the person connecting you to language support is unfamiliar with your request. Another helpful phrase is, I need an interpreter. Another helpful phrase is please and thank you. Don't forget, you have a right to language support. In addition to having a right to language support, you also have a right to privacy. You do not have to tell anyone other than your doctor about your health issues. This includes your employer, your friends, your church sponsor, etc. If you are afraid to call into work due to a medical issue, contact your case manager who can help you with that. The Health Insurance Portability and Accountability Act of 1996, also known as HIPAA, is a federal law that required the creation of national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. Thanks to HIPAA, your medical history and information will be kept completely confidential unless you agree for it to be shared. Before your medical information is shared, you will be asked to sign an agreement form. You will need this in order for your doctor's office to share medical information with another doctor's office or even with your spouse and other family members because your privacy is a top priority. You also have a right to receive high-quality healthcare that is respectful of your cultural beliefs and to have information presented to you in a way that you understand. So, what else should you know about health practices in the U.S.? Some health practices are similar to norms in your home country. However, some health practices may be different from norms in your home country. Fortunately, in the U.S., we have access to the latest medical advancements and highly sophisticated medical care and treatment. There are a vast variety of options here in the United States, and it may feel a bit overwhelming at times. If you have concerns, feel free to ask your doctor about any health practices you are unsure about. Some traditional medicines or practices from your home country may be considered unsafe or even illegal by U.S. standards. Do not seek medical care or treatment from anyone other than a medical professional. Now, we will talk about how to access healthcare coverage, also known as health insurance. The United States has no universal healthcare system, and refugee and parolee medical assistance differ state by state. Fortunately, refugees and Afghan evacuees are eligible for health insurance, and New York State has a more supportive welfare system than many other states. For now, we will do a basic overview. However, it is important to realize that healthcare coverage options in the United States are complicated and conditions may apply. There are many different options available that depend on your family's income, employment status, and individual needs. Your case manager will explain the details to you and your family because healthcare plans can greatly vary case by case. Today, we will focus on Medicaid and Medicaid managed care plans because many refugees, asylees, and parolees receive healthcare coverage through Medicaid when they first arrive in the U.S. Medicaid is an income-based benefit, and eligibility is determined by the household income, household size, and if there are any other health coverage options available to you, such as through an employer. Your case manager at Journey's End or your caseworker at Department of Social Services can explain more in detail and answer any questions you may have. Your Medicaid card will look like the one pictured here. Please note that your Medicaid card may also function as a benefits card and may be used to access SNAP, also known as food stamp benefits. However, depending on your family situation, you may have a different card to use, so your case manager will explain this to you in detail. Some individuals who are eligible for Medicaid are automatically transferred into a Medicaid managed care plan. Medicaid managed care is the delivery of Medicaid health benefits and additional services through contracted arrangements between state Medicaid agencies and managed care organizations, such as private health insurance companies. In other words, many people receive health care coverage through Medicaid. Some people will just have a Medicaid card with health care coverage provided directly through Medicaid, and you will not have a managed care plan nor a managed care plan card. But some people will have Medicaid health care coverage that is provided through a private health insurance company. This type of coverage is referred to as a managed care plan. You may have different coverage than your extended family or friends. If you do not choose a specific plan, you may be assigned a managed care plan at random. Some plans are better than others. It is important to discuss with your case manager or Medicaid caseworker the medical needs of you and your family members so you can choose the best of the available options. If you are covered by a managed care plan, you will need to bring your Medicaid or benefits card as well as your managed care plan card to every doctor's appointment and every visit at the hospital. If you are covered through a managed care plan, it is very important to have both cards with you when receiving any health care or treatment so that your health insurance can be billed properly. Even with healthcare insurance, it is likely that you will have some healthcare-related expenses that are your responsibility to pay. These expenses are described as out of pocket because you must pay for these with your own money. Your out-of-pocket expenses will depend on your healthcare coverage and your healthcare needs. You can minimize costs by only visiting medical providers that accept your specific type of healthcare coverage or insurance. Your Journey's End case manager will schedule your initial health assessment and connect you to a primary doctor that accepts your current health care insurance. If you visit a healthcare provider that does not accept your health insurance, It can be extremely expensive. Copayments, often referred to as a copay, is a common out-of-pocket expense that you must pay when you visit the doctor's office, a hospital, or pick up prescriptions from a pharmacy. A copay is usually a modest, flat fee starting at $1 for a generic prescription drug. Occasionally, you will receive a medical bill in the mail. This may be for a number of reasons. Your health insurance was not accepted, your health insurance information was not yet received by the provider and you must submit documentation, or you may have an outstanding bill or copay. If you have any questions, bring your bill to your case manager who can figure out what to do and show you how to take care of it yourself next time. Next, we will talk about healthy habits and hygiene. Preventative health care plays a large role in maintaining good health. Preventative health care includes routine health care, such as regular primary care doctor appointments, screenings, checkups, and patient counseling to prevent illnesses, disease, or other health problems. Preventative health care reduces the risk for diseases, disabilities, and death. Immunizations are an extremely important part of preventative healthcare, which is just one more reason to get the COVID-19 vaccine if you have not already. You have the power to practice preventative healthcare in your day-to-day life as well as through healthy habits and good hygiene. Healthy habits that reduce the risk for diseases, disabilities, and death include regular exercise, getting 8 hours of sleep every night, drinking plenty of water, and eating a nutritious diet. One of the most important healthy habits we can do is drink enough water. Being hydrated helps your body function as best as it can. Try to drink at least 8 glasses of water every day. In some camps, folks are told not to drink the water as it is dirty and can make you sick. Fortunately, it is safe to drink water right out of the faucet here. You will also save a lot of money by drinking water from the faucet instead of buying bottled water. You can buy a filter to improve taste of water from a faucet, but it is not necessary. An easy way to stay hydrated is to carry a water bottle so that you can keep up your water intake on the go. One of the other most important healthy habits is to eat lots of vegetables and fruits and to avoid sugar or processed foods and drinks. American fast food and processed food is full of unhealthy fats. Eating a lot of processed foods, fat, and sugar can make you fat and unhealthy. Fast food, processed food, and sugar is especially bad for kids. Kids who become very overweight can have lasting physical health issues and are also more likely to develop depression. Too much sugar can also lead to cavities as well as diabetes, among other health issues. Soda is tasty, but it has no nutritional value, which means it does not provide you with any good vitamins to stay healthy. It has a lot of sugar in it. Be sure to limit the amount of sugar your kids consume, such as soda or candy, as it can lead to cavities and long-term health problems. The American Heart Association recommends that children consume no more than 1/4 of a liter of pop or sugary drink per week. Children under 2 years old should not consume processed sugar at all. Natural sugar in fruits is balanced by many other vitamins and nutrients and is an important part of a healthy diet. Try to eat 4 to 5 cups of fruit or vegetables every day. Processed sugar in foods such as donuts, cookies, and other sweets that have low nutritional value should be enjoyed in moderation and only occasionally. Washing your hands thoroughly and regularly is an important hygiene habit that can help prevent illness. Use soap and water and scrub for at least 20 seconds. Hand washing prevents spread of germs, including COVID-19. Don't forget to wash your hands before and after eating, after using the bathroom, and when you return home after work or school. Another important hygiene habit is to shower or bathe often. Everyone is different, and how often you shower or bathe may depend on what type of work you do. For example, if you work a physical, labor-intensive job and sweat during the day, maybe you will want to shower or bathe every day. If you do not work a physical, labor-intensive job, maybe your routine will be bathing every other day. It is up to you to decide the best routine for staying clean and smelling fresh. Americans are extra sensitive to smells, so make sure to wash your underarms and use deodorant to prevent body odor. There are many different options for deodorant and antiperspirant, including natural products. Another important hygiene habit is brushing your teeth. Don't forget to brush your teeth at least once in the morning and once at night to prevent cavities and other dental issues. The United States is a diverse country. We are diverse not only in terms of our population, but also when it comes to fashion and personal expression. As a new arrival to this country, maybe you are wondering if there are any expectations or rules to follow when getting ready or going out in public. There is not just one standard of dressing and grooming, and you may have already noticed that the American attitude of individuality is also obvious in what we wear. Fashion and personal grooming are ways to express ourselves, and people wear whatever we want here. It may be a bit confusing and hard to guess what the status quo is. There are no specific rules when it comes to what you can wear or how you can style your hair or hijab. The standard norm in the US is just a cleanly appearance and to not smell of body odor. Especially in the wintertime, practicality is important to consider as well. Wearing layers, such as a sweater or sweatshirt under your coat, will provide extra warmth in the cold, as well as thick socks that also cover your shins and calves. Journey's End acknowledges that dressing appropriately for the weather can be a challenge, especially in the wintertime. Please ask your case manager or your teacher at Journey's End if you need a winter coat or hat or gloves or scarves or any other clothing item. We can provide you with outerwear and can refer you to a free clothing closet nearby. Secondhand stores like Amvet's, Goodwill, or Savers are also awesome places to shop for extremely affordable clothing and household items. You can even find very high quality brands and fabrics at secondhand stores for cheap. Journey's End also acknowledges that washing your clothes at a laundromat can be expensive. It is recommended to wash socks and underwear after one use. However, you can get by with washing other clothing items less frequently with a few tricks. The farther a layer is from your body, the less frequently you have to wash it. For example, socks and underwear should be washed after one use. Tights, leggings, shirts should be washed every 2 to 3 wears, while heavier fabrics, such as jeans or sweaters, can be washed every 4 to 5 wears. Coats and jackets can be washed once per season unless soiled or smelly. Remember, these are just guidelines and you may wash more or less frequently depending on your lifestyle and what clothing items you have. An easy rule to follow is to wash anything that is visibly soiled and to do a quick sniff test. If the clothing items smell, it is time to wash. Keep in mind, Americans are very aware and expect others to actively prevent and control personal body odors. More tips for keeping clothes fresh between washes include: do not wear tops more than 1 day in a row, do not wear bottoms more than 2 days in a row, and hang up clothing items to air out in between wears. Airing out your clothing items between wears works surprisingly well. Please ask Journey's End for personal hygiene products if you need any. Next, we will talk about the ongoing COVID-19 pandemic. The most effective way to protect yourself against COVID-19 is to get vaccinated. We are very fortunate in the United States and have several different vaccines easily available to everyone. All steps have been taken to ensure that vaccines are safe and effective for people ages 5 years and older. The vaccine significantly lowers your risk of getting and spreading the COVID-19 virus. If you are vaccinated and still get COVID, it is much more likely you will experience mild symptoms. It also helps prevent serious illness and death caused by COVID-19. Unvaccinated people are at a much higher risk of experiencing moderate to severe COVID-19 symptoms that can result in lifelong health issues or death. The Pfizer and Moderna brand vaccines are very high quality and are available for free in the United States. Please talk to your doctor about what concerns are preventing you from getting the vaccine if you have not gotten it already. For your information, all Journey's End employees, including interpreters that interact with clients, are required to be vaccinated unless granted a medical or religious exemption. So, let's all do our part together to keep each other healthy. You must be vaccinated to attend any in-person English classes at Journey's End, which is another great reason to get vaccinated. Many students say that in-person learning is more engaging and it is a fun way to meet new friends. The best way to prevent illness is to avoid being exposed to this virus. To help prevent the spread of COVID-19, you should wear a mask to protect yourself and others and stop the spread of COVID-19. Stay at least 6 feet, about 2 arm lengths, from others who don't live with you. Avoid crowds and poorly ventilated spaces. The more people you are in contact with, the more likely you are to be exposed to COVID-19. Get a COVID-19 vaccine when it's available to you. Clean your hands often, either with soap and water for 20 seconds or a hand sanitizer that contains at least 60% alcohol. Avoid close contact with people who are sick. Cover your cough or sneeze with a tissue and then throw the tissue in the trash. Clean frequently touched objects and surfaces daily. If someone is sick or has tested positive for COVID-19, disinfect frequently touched surfaces. Also, monitor your health daily. COVID-19 affects different people in different ways. Infected people have had a wide range of symptoms reported, from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. You should be aware of the emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, or pale, gray, or blue-colored skin, lips, or nail beds, depending on skin tone. Please note that this is not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility to notify the operator that you are seeking care for someone who has or may have COVID-19. If you experience symptoms of COVID-19, you should get tested for the virus. You should also get tested if you have come into close contact with someone with COVID-19 and should be tested to check for infection at least 5 days after you last had close contact with someone with COVID-19. You should also get tested if you have been asked or referred to get tested by your school, workplace, or healthcare provider, even if you are vaccinated. You can take an at-home COVID-19 test or visit one of the many testing sites in Erie County. You can order free COVID-19 at-home tests through the mail at covidtests.gov or call 1-800-232-0233. Every home in the United States is eligible to order 4 free at-home COVID-19 tests. The tests are completely free. Orders will usually ship in 7 to 12 days. You can also visit one of the many testing sites in Erie County. Testing site location and hours may vary, so contact your primary doctor's office to find out where you can get tested. And of course, you can contact your case manager to help you get a COVID-19 test if needed. We will now talk about what to do if you test positive for COVID-19. First, you must isolate for at least 5 days. To isolate means you must stay away from everyone, including your family, to minimize the risk of infecting others. If possible, stay in a separate bedroom alone and do not leave unless you need to use the bathroom or grab something to eat or drink. You can end isolation after 5 full days if you are fever-free for 24 hours without the use of fever-reducing medication and your other symptoms have improved. Loss of taste and smell may persist for weeks or months after recovery and need not delay the end of isolation. Day 0 is your first day of symptoms. If you test positive for COVID-19 and never develop symptoms, isolate for at least 5 days and wear a well-fitting mask around others at home and in public for an additional 5 days. Day 0 is the day the sample was collected for a positive test result. Wear a well-fitting mask around others at home and in public for 5 additional days after the end of your 5-day isolation period. Take additional precautions on days 6 through 10, such as avoiding travel and situations where you will come in contact with individuals at high risk for severe disease. If you are unable to wear a mask when around others, you should continue to isolate for 10 days. Contact your healthcare provider as soon as possible if you are more likely to get very sick because of being an older adult or having underlying medical conditions, or if your symptoms get worse. If you are caring for someone with COVID-19 at home or in a non-healthcare setting, follow this advice to protect yourself and others. Learn what to do when someone has symptoms of COVID-19 or when someone has been diagnosed with the virus. This information also should be followed when caring for people who have tested positive but are not showing symptoms. Please note that older adults and people of any age with serious underlying medical conditions are at a higher risk for developing more severe illness from COVID-19. People at higher risk of severe illness should call their doctor as soon as symptoms start. When caring for someone sick at home with COVID-19, help cover basic needs. Make sure the person who is sick drinks a lot of fluids and rests. Help the person who is sick follow their doctor's instructions for care and medicine. See if over-the-counter medicines for fever help the person feel better. Make sure the person who is sick drinks a lot of fluids and rests. Help them with grocery shopping, filling prescriptions, and getting other items they may need. For most people, symptoms last a few days and people usually feel better after a week. COVID-19 spreads between people who are in close contact, within about 6 feet, through respiratory droplets created when someone talks, coughs, or sneezes. Staying away from others helps stop the spread of COVID-19. The caregiver, when possible, should not be someone who is at higher risk for severe illness from COVID-19. The person who is sick should isolate. The sick person should separate themselves from others in the home if possible. Have the person who is sick use a separate bedroom and bathroom. Try to stay at least 6 feet away from the sick person. If you must share space with the person who is sick, make sure the room has good airflow. Open the windows to increase air circulation. Improving ventilation helps remove respiratory droplets from the air. Avoid having visitors. Avoid having any unnecessary visitors, especially visits by people who are at higher risk for severe illness. Caregivers and anyone who has been in close contact with someone who has COVID-19 should stay home and except in limited circumstances. We have now reached the conclusion of the presentation. Thank you for taking the time to learn more about adapting to life in the United States. Journey's End hopes that you found this presentation informative and will use this information as a guide to live a healthy lifestyle here. Take care.